Second. And the two fair. Whatever you can
Good evening, everyone. Hi. Welcome. This is Open Forum. My name is Dr. Hunter Peterson, and give me a show of hands of who's new here tonight, who hasn't been in Open Forum. All right.
What was the question?
Who hasn't been to an Open Forum? Quite a few of you. Okay, welcome. This is a monthly engagement we do here at Pilgrim's Education Center. This same time and day, the first Wednesday of every month. I come prepared to talk about a topic, but I very much consider the Open Forum a discussion. So it's an opportunity to bring health questions, to have a dialogue, and don't hesitate while we're talking tonight or while I am going over our topic to raise your hand, interrupt me. I love to kind of pivot off to that discussion. So, as you can all see, we are recording the lecture. If you want to rewatch it or show it to a friend, we'll have that on our website, CoeurD'AleneHealingArts.com. And I guess I should introduce myself a little more. For those of you who don't know me, my name's Dr. Hunter Peterson. I am a naturopathic physician and the clinic director of Coeur d'Alene Healing Arts. So we're just right downtown, a few blocks that direction, and we've been there for about 30 years. My predecessor before me, and now myself. So, today we are going to talk about homeopathy, which is a really favorite tool of mine in clinical practice. So that's going to be the bulk of the kind of initial part of our conversation. But what I'd like to do is take an opportunity first to pull in any questions that any of you have, all things health related, and I'm going to write them on the board, and we will save them for the end of the homeopathy talk to go over sequentially. So who wants to start us off? What questions are there? Yes?
Is there
Tanya.
homeopathy for like detoxing the body?
Ooh, in a way you can use it. That's a very interesting question. Let me just make a note of it and I can talk about drainage with you. So homeopathy detox. I'll cover that. Yes?
Okay, cancer.
Cancer.
Does homeopathy apply to cancer treatments?
Okay, yeah. I mean, the short answer is absolutely, but yeah. Next month, the lecture is on cancer, so that'd be a great one to attend, but yes. Cancer and homeopathy. Great questions, and by the way, they don't have to be related to homeopathy, so just put that out there. Yes?
Interested to learn more about fasting, especially from like an ND's perspective.
Yeah, sure. Fasting, that's a pretty broad topic. Can you give me a little more context of what you hope to know more about?
Like how you would suggest going about fasting, how long, kind of the overall health benefits, and like how to properly prepare your body for a fast.
Sure. And again, we have done a whole open forum on that topic, so if you ever want to peek at, a good hour-long conversation about it, it's on our website. Okay. Yes.
What about normalizing cholesterol levels?
Yeah. I'm assuming with that you're seeking natural approaches and maybe causes.
Yeah.
Okay. Great.
I have two fungi-related questions.
Okay.
One is, why do some supplement companies use aspergillus, which I suppose there's some different types
Yes.
of aspergillus? Why do they use that in making some vitamins and enzymes? And then the other, I'll write that off, I'll give you the next one.
Sure. Yeah.
And then in Dr. Jerry Tennant's book on voltage is healing, he says that as the cell pH or voltage goes, drops in a cell, that fungus in the human wakes up and infects the human cells.
As the pH you said, or
As the,
voltage?
he equates the pH to voltage
Oh, okay.
in the cells.
Okay.
And he suggests that the fungus then takes over the DNA, changing the cells into cancer cells.
Hmm.
I wonder
Okay.
if you could comment on that.
Okay. Sure, I can give you my take on what I know. Acid in cancer. Sure. Others? Ben?
I said I wasn't going to ask about the Williams book, but I changed my mind. So I have a million questions from there, but simply I just am wondering if you've heard of the whole Epstein-Barr herpes premise.
Mm-hmm. Oh yeah, I've read that book.
Okay. So could you just, for tonight, I know it's full, like just say a few little words about that particular piece?
Mm-hmm. Yeah.
And
So Epstein-Barr virus, chronic viral infections.
herpes as predecessor or cause of almost all of the other biggies.
Okay. Yeah.
And then protein, so for a male at 160, you had said about 50. Is that different for, or my male in particular?
Yeah.
And then for me at 112 pounds, could you just say about how much grams of protein?
Yeah, generally 1 gram per kilogram. I mean, we'll have to individualize that, but yeah. The kilogram's 2.2 pounds.
So it's still half of your body weight?
Basically half of your body weight, slightly more than, yeah.
And then, if you'd be willing to just say how you exactly make your ghee.
Oh, sure.
Which butter, how long, you know.
Sure.
And I won't ask any more questions. I mean, even about the ghee, but you could just like run through it. And
Yeah, sure. That's easy.
I'll write that. Okay.
No problem.
That's it,
Great.
kind of.
Yes.
I've done a little on Ayurveda,
Yeah.
but there's controversy over comfrey.
Okay.
It's just.
The
tell me
use
what-
of comfrey as an herb?
Orally, yes, instead of just as, I've seen it in things that you put on the skin,
Right.
but there's also comfrey teas that they
Yeah.
talk about for
Sure.
bones and gastric problems. But there's also controversy in the literature about comfrey being dangerous.
Yeah,
And
toxic.
having liver.
Yeah, it's a really good one in the homeopathy conversation because we use comfrey all the time homeopathically. But I can talk about it as the crude herb too. Sure.
I'm interested in that too, and I've often wondered about that.
Okay. Great. In the back there.
I'd like to know your opinion about the over-the-counter homeopathics and the potency of them, and if they're as good as the ones that you would make up,
Sure,
like
Linda. Yeah.
boron and Highland.
Yeah. Uh-huh. Great. Yes.
Do you have a suggestion of herbs to grow that are good to use in the home?
Like local herbs that can be grown locally?
In your own garden? Yes.
Sure, yeah. That'd be a great one. What others? Have a couple more spots. Anything else?
Half aboard.
Yeah, right. Yes, in the back.
Does coconut oil kill good bacteria?
Okay. Coconut oil. Okay. Any other questions? All right. Well, let's start talking about homeopathy. Couple of housekeeping things first. how many people didn't get a little packet on homeopathy? Okay.
Got one or didn't get one?
Didn't get one.
Right here.
Okay, so what I'm going to ask is if it's possible, if anyone came with another family member, if there's any extras, if you could, you know, pass off the extra one that you have and keep just one for the family, and otherwise, I have 2 more here. And then lastly, what I'm going to do is I have this clipboard to hand around in case you want to be on our listserv or hear about events, education opportunities. So you can fill that out if you want to, but more specifically, make a big note with an asterisk in the notes section that you didn't get a set of handouts, and I can make sure you get a copy as long as they have your contact info. Okay? So here's those 2 copies. I'll pass them back. I think a couple people are needing them. And then that's right. And of course, this note packet is companion. I'm going to try to really cover everything today, so take notes. And again, the video will be available to really review. Okay, so homeopathy. So the purpose of this lecture, and this is going to be a daunting task, is to take what I usually do in a 6-week course and distill it down into 1 lecture. So it's going to be very abbreviated, and I don't want to take this as a substitution for us all becoming experts in acute homeopathy, but it's such a wonderful tool that I want to introduce all of you to it and have you leave this lecture with at least a functional grasp of how you might go about using this tool to treat a myriad of acute ailments. And some of those areas of treatment are listed, of course, in your packet, as well as the remedies that we'll be covering today. So, you know, a first starting point is that when we're dealing with acute illness, let's be clear about what that is. An acute illness is something that generally comes on very quickly and typically leaves quite quickly too. Examples are upper respiratory infections, sore throats, diarrhea, urinary tract infections, influenza, headaches, at least acute ones, fevers, earaches, sore throats, croup. Just a few examples to mention. These illnesses, unless they kill us, we're going to get over them fairly quickly. Why would we use homeopathy? We seek to either, when we get stuck in that illness, to help us get over that stuck place, and to shorten the duration of illnesses if possible. So that's what we're going to be learning the context of homeopathics, how to implement a very powerful tool to do so. Now, of course, there are other great tools out there that exist to deal with acute illness, and I want to mention a few of those. I'm not going to talk much about drug therapy because it's a tool I find myself needing to use about a handful of times a year for acute illnesses. I find that almost anything can be treated with natural means effectively, homeopathy being a really powerful tool. However, I want to mention a couple of just fundamental things that I think benefit all of us when we start to develop symptoms of acute illness. So first and foremost is probably the most powerful, which is fasting. Someone asked a question about fasting. One of the indications for fasting, probably the most prominent, is upon the onset of an acute illness. When we fast the body, and what I mean by fasting is I mean discontinuing the consumption of foods, essentially. So putting ourselves on digestive rest. When we fast the body, 2 really important things happen. One is that we stop using that about 40% of our energetic output that we use every single day to digest our food, and we reallocate those resources, much of it going to the immune system. So in that way, it really helps our body take care of the process. Secondarily, one of the major driving forces of sustaining an acute illness is essentially feeding the infectious process, right? Usually acute illnesses have some relationships with viruses, with bacterium, with fungus, and if we are consuming substances that feed that, then we are going to slow down the pace at which the body overcomes that infectious process. And specifically, the forms of foods most prominent, if you say, I don't know about complete fasting, that sounds a little hardcore for me, but at least I can avoid the things that will lengthen the illness, then those prominent things are going to be all dairy, all sugars, including starches and processed foods, right? That's breads and pastas and crackers and the types of things that are starchy that the body turns into sugar. Most prominently, and really, really heavy proteins, a lot of red meat, a lot of dense meats, etc., processed especially. Okay? So that's a first and foremost principle. Now, when you say fasting, do you mean water fasting? Usually what I advocate is you make a vegetable broth with things like carrots, celery, zucchini, onion, spices, cook it down really good and either blend it up or just eat it with the really cooked down vegetables. What that's going to do is provide a lot of electrolytes and a lot of fluids to your body, which will help assist in the healing process. Of course, fluid intake is really important too, and really getting up to at least half your weight in body ounces when you're feeling ill of water is very critically important. Hydrating the cells is huge in dealing with an acute illness. Okay, so that principle always applies to any acute ailment, and probably, honestly speaking, before that illness has an ability to take hold, your body will probably clear it within 24 to 48 hours just by doing that alone. It's very powerful. Secondarily, the modality or tool that I always advocate when an acute illness happens is what's called contrast hydrotherapy. In contrast hydrotherapy, we are using the premise that the immune system gets where it needs to go via the circulation. So if we have poor or sluggish circulation, that's going to allow an infectious process to take hold and spread if the immune system can't get where it needs to go. So contrast hydrotherapy is the application of alternating hot and cold to the skin surface. We can do that in showers, we can do that in baths, we can do that with actual application processes directly to the skin, such as putting cold, wet socks on and covering them with wool socks and insulating them and going to bed. Or if it's a chest infection, putting on a cold, wet t-shirt and covering it with a thick sweater and going to bed. This drives a blood flow circulatory process to the tissues to get the immune system where it needs to go. So those tools can be invaluable. For example, the warming socks is probably a leading pediatric remedy that I use to great effect of any sort of respiratory, snotty nose, congestive illnesses, and anything from infants to children, as well as adults.
Would you just repeat that process, the sock thing?
Yeah, every night usually, until
No.
it clears.
Would you repeat what you said about
Oh,
how
yes.
to use it?
Sure, yeah. Usually how you use it is you take thin cotton socks, put them in cold water, wring them out, put them on your feet, and then cover them with thick, ideally wool socks. They don't have to be wool, but that's better, they're more insulating, and go to bed. And what that's going to do is drive a really powerful circulatory response. It's particularly useful when there's congestive symptoms. For example, the sinuses are congested because it draws a lot of that circulation out of the head. It's very useful. Yeah, Jean?
I found that after only a couple of hours my socks turn dry. Should I re-soak them in the middle of the night?
It's probably not critical, but it would be useful if you're getting up. I mean, the most important thing is good rest, so I would definitely not wake yourself up to replace them, or if you replace them and you woke yourself up more by doing that, it probably would be better just to stay asleep.
I have a baby, I heard.
Okay, there you go. Yeah. So that's a good sign of a really vital organism, a vital force, that you're drying them out so quickly. So yeah, you could if you wanted to, but not critical.
Can you
Yes.
Explain like what you mean by to help get the immune system where it needs to go.
Through circulation. So, right, our blood vessels are the highways, so to speak, of all of the cells in our body and the substances that need to be transported. So, if we don't have good circulation, we don't get any sort of substance, nutrients, waste products in and out of where they need to go. So, in terms of immunologically, usually infectious processes are not systemic. They usually localize to specific tissues. So we want to drive that immune response to those tissues. And also we want to really milk the lymphatic glands, which is really how the immune system moves, and dump out the waste products and recirculate the fresh nutrients in immune cells. We found scientifically doing hydrotherapy, actually we can measure rises in white blood cell counts while doing it. It's a pretty cool therapy. It's good scientific evidence for that.
Are you calling the wet socks hydrotherapy?
Yes, it's a mode of hydrotherapy and
Okay.
method.
Just
Yes.
clarified, yeah,
Also can be done in the shower by contrasting hot and cold.
okay.
If you ever do contrast with applications in water, important to always end on cold. It actually is better for the circulatory process to end on cold. Okay. Yeah.
And the brushing the skin, is that pretty effective?
Yeah, dry skin brushing is a similar concept. It really moves the lymphatics, which is again that immune highway. And so I always recommend that that be done toward the heart. So you start at the peripheries, same thing with hydrotherapy with water, and bring the blood flow or lymphatics back towards the heart.
And just a few times each?
Yeah, just a
area?
few brushes to each area, and again, always going to the heart. Yeah.
I've always wondered about, I've heard for years about dry brushing, but why is it important to be dry? Why can't you use a brush in the shower?
Sure, you can. That's not that problematic.
Because I have a shower brush that I use.
Yeah, or a loofah or something.
Yeah.
Sure, you can do that. Okay. All right. Okay, so that was, sorry, a little aside, but those are super helpful concepts if you haven't heard about them. So hopefully those can be helpful to you. Okay, so in order to utilize homeopathic medicine, its principles are really important to understand. And this might get a little esoteric here because homeopathy is a notoriously difficult thing to explain. It kind of flies in the face of a lot of our Western medical principles. So in Western medicine, we come from a very reductionist model in which we focus on the individual parts and talk about how those individual parts can be treated separately, right, with chemistry, with very tangible things. So that's why we have specialization, right? We have problem with the heart, you see the cardiologist. Problem with the brain, you see the neurologist. So we've subdivided out all of these ways of looking at a human being. Whereas one of the principal tenets of homeopathy, or one of the principal assumptions, is that we are by design energetic in nature. That we exist on a deeply patterned level where the whole organism is much greater than its component parts. Okay, so that concept of how we review what we are as human beings is very different, in that we acknowledge that there's an enlivening force beneath us, a electrochemical and energetic frequency that informs all of the processes in our body. A good example of that is when we look at, on the very quantum level of mechanics, we look at the atom, for example, we can see that an atom has electrons buzzing around it, and there are neutrons, and there are all these constituents that resonate at very specific frequencies, right? And the atom is essentially the building block of all cells, all living things. And so if these atoms have a resonant frequency, then we understand that these resonant frequencies play off each other and interact with each other. Let's take that to another example of a more real-life phenomenon. So perhaps one of you has, or many of you, most of you, have been in a circumstance where you're in a room, maybe you're with some other people, maybe you're with your family, and an individual walks into the room who's very, very upset about something. Now, we know instinctively that that person's upset. Did they say anything? Did they say, I'm upset? Did they yell at you? No. You can just tell by their presence, their energetic frequency of that person walking into the room, that they are upset. Very similarly to where you can find other emotional feedback by gauging someone's energetic frequency, or another term we use that's more slang is the vibe, right? So this is an example of these dynamic forces that animate us, that guide profoundly our interaction as human beings and our interactions on a cellular structural level. Okay.
Would that be equated with chi?
Yeah, another example for that is chi. Another example would be the vital force, right? Is this energizing frequency signature that is dynamic and overarching, informing all of the processes at work in our body. And it's not something we can quantify. It's not something through the scientific method we can go in and state, oh, we can measurably observe this force. Yet we all recognize that these things exist, that we can readily perceive some other inherent force that engages with our biology. And that concept is really important in the philosophy and principle application of homeopathy. Okay, so we'll come back to that. Does that kind of make sense to most people? All right. So let's talk about the history of homeopathy. If we do some medical anthropology, fast-paced, we start with a guy named Paracelsus. And one of the things Paracelsus observed is that the disease and the medicines are one and the same. That was a finding he observed through his long career in medicine. And so this guy came along a few hundred years later. He was about in the 1200s, 1300s. He was a German physician, conventionally trained, named Samuel Hahnemann. Long word to pronounce. So this was probably the 1750s. And he was kind of a medical anthropologist. He liked to read a lot of old medical texts. And he came upon a description in Cullen's Materia Medica that had to do with what's called cinchona bark. Cinchona bark is a very astringent herb, and his finding was that in individuals who had come down with the disease process of malaria, that when given the cinchona bark, in a large number of cases it cured the malaria. And what Cullen did is he attributed the cause of that to the bitterness of the cinchona bark. So Hahnemann looked at that and he said, well, that doesn't really make sense to me, because I know of 20 or 30 other herbs that are much more bitter than cinchona. So why would that herb cure the malaria but not all these others? And then he did a really interesting thing. He, like most good doctors, myself included, he started experimenting on himself. So he started, and he was healthy, he didn't have malaria, he started taking cinchona bark every single day. And what happened was Hahnemann started developing all of the symptoms of malaria, right? He hadn't contracted the microbe that causes malaria. He hadn't been bitten by a mosquito, but nevertheless, he started manifesting all of the symptoms present in malaria. And so what he conducted in that case is what in now homeopathy we call approving. And from that experiment, he came to probably the most profound principle realization of homeopathy, which is the principle of like cures like, right? So, in other words, an individual presenting with malaria as the disease process, if they are given a substance that in a healthy person creates the symptoms that mimic the disease process, then giving that substance can cure the individual of the disease. It sounds kind of contradictory, right? To give somebody something that causes a set of symptoms in a sick people, the same symptoms as the disease, will actually cure them. But this law of similars is the foundational principle upon which homeopathy is built. Questions about that concept? About we'll go into it more, but what it's essentially proposing. Okay? All right, so what happened was after Hahnemann did that, he started actually conducting large-scale trials on many substances. So in that case, he was using a plant. So he started using other plants to do provings, to give those plants in crude doses to healthy people, and then seeing what type of response would be elicited and recording those responses. He also did not just use plants, but he used minerals. Okay, so he used calcium, he used magnesium, he used phosphorus, he used sulfur. Some of the big remedies we'll be talking about are minerals, constituents from the earth. And thirdly, most prominently, he also used actual substances from animals. For example, snake venoms. He used, trees. He used bird feathers. He used various tissues, the ink from a cuttlefish, right? So all these interesting things he did provings on with healthy people and determined sets of symptoms that those people developed when repeatedly taking the remedy. And eventually what happened was all of those symptoms for each remedy were brought together in a book called Homeopathic Materia Medica. I have one up here. And so it goes through each organ system, including the mind, because some of the symptoms that were created were not just physical symptoms, but mental and emotional symptoms. Restlessness, irritability, euphoria, anger, impatience, fears, right? All sorts of interesting cognitive mental symptoms would also show up too. But additionally, physical symptoms. And so he basically chronicled all of this in a Materia Medica, so that when he observed a sick person, he could observe the totality, the entire presenting symptom picture of the individual, and try to match that to the closest remedy based upon the provings that had been done on these hundreds and actually thousands of remedies. Okay? So questions about that concept, about how we get to that point of developing a Materia Medica and how it was created, how it's used. Yes?
You know how some, like you were talking about the snake venom, is that something that's used for somebody who has a snake bite?
So that's interesting. It can be, but actually the principle of homeopathy, we're going to get more into this, is that it's the law of similars. So it doesn't mean that you take a substance that has harmed a person, like a toxic herb, like an overdose of Belladonna, and you give them Belladonna because they develop those overdose symptoms. It often can be a different remedy, but on some occasions you can actually give the same substance in a homeopathic preparation and it can cure it. But that's not always the case. Okay. Another example, a remedy we'll talk about is apis, which is the venom of a honeybee. Sometimes with bee stings, the remedy apis may be indicated, but it depends upon the presenting symptoms. If the presenting symptoms of the patient who has the bee sting matches the presenting symptoms of apis in its Materia Medica, then it might be the correct remedy. If it doesn't, it will not be the correct remedy. Okay, so this is where we're going to talk a lot about individualizing symptoms, and we'll get more into that. Okay, so let's give an example of a case where we have a sick person. So this person has a fever. It's a pretty high fever. It's 104, 105. They have a sore throat. They have a pounding headache. They have a flushed face. their hands and feet are fairly cold. They have a swollen red throat. It's shiny, and it's worse on the right side. And then they have a headache that is worse when they lie down. So, when we see that picture, it's interesting because if you look at the toxic plant Atropa belladonna, which is also known as deadly nightshade, someone who has taken, a healthy person who has taken crude doses of this plant, that matches those symptoms. Okay, that's the type of overdose symptoms that would happen when you consume belladonna. So, in administering the homeopathic preparation of belladonna, the patient will get a swift reversal of their symptoms by stimulating an immune response in the body to heal. Okay? So, here's an interesting thing though, right? So why would we give someone a toxic plant like belladonna, right, that has the potential to be very harmful? A botanist would say, you don't give that herb to people because it's poisonous. So this is where Hahnemann came up with a really critical second principle of homeopathy, and this is one that particularly agitates and aggravates the conventional medical community because it really defies our very much logical scientific method, in that what he discovered is if he was able to prepare the homeopathic medicines in a method of serial dilutions, in other words, taking the crude substance and diluting it by factors of 100, but in a very specific method, and that specific method would be taking a remedy that's diluted in 100-to-1 quantity of 1 part of the substance to 100 parts alcohol or water, and he vigorously shook it, that he was able to capture the energetic signature of that substance while removing the toxic effect. And now we have actually very good scientific research to support this theory in modern day, not when Hahnemann was around, but now. It's called quantum physics. And we've actually done profound amounts of research, for example, on the molecular memory of water. Water is the substance through which we succuss, or what's called potentize, the remedy. So what he discovered is through these serial dilutions, but very importantly with the succussion aspect, he could remove the toxic effect of the substance while maintaining the energetic signature. And in that way, we can administer homeopathic medicines that exert the medicinal effect without any of the toxic elements of the crude substance. Okay. Now, tell me what your questions are about that.
How did he come to that process of deciding he's going to shake
You know,
it and it gets...
I think it was a long process of discovery. I don't know what insight he had to one day say, why don't I try to dilute this and through this method, and found that it was remarkably effective without the initial reactive aggravations by giving the crude substance. I do not know what gave him that stroke of insight, but it was a great one. And interestingly, this is the most infuriating part for some people who have very logical brains, is what he found was the more he potentized or diluted the remedy, the more powerful the action of the remedy. So he found that if he diluted it 10 to the 6th, it was much less potent, much less strong of an action than if he diluted it to 10 to the 200th. And the thing about that is that once you get beyond 10 to the 23rd, which is called Avogadro's number, if we know that in chemistry, that is the number where technically there is only one single molecule of the crude substance in a mole, or essentially a certain quantity of substance. And so technically a remedy potency that is called 30C does not have a single molecule of the active ingredient substantively in it. Now that energetic signature that's been transmitted, it's absolutely there, arguably more powerful. But the actual crude substance has been essentially removed from the remedy. And so obviously scientists that are very focused on tangible, measurable things, homeopathy can be a big, big problem to them. Yeah. Yes?
Have they, I mean, you talk about like the advancing science and quantum physics, and,
Yeah.
but have they done double-blind studies that compare the results of homeopathy versus, say, a placebo effect? I mean, when you're talking about dilutions of 10 to the 6.
Yeah. Yeah, in fact,
It's insignificant.
yeah, so the first double-blind placebo-controlled trial was homeopathic trials before any Western medical sciences were even created. Around the double-blind trial, it was actually homeopathic in nature. Now, the challenge of doing that, of course, is that one of the things we're going to talk a lot more about is homeopathic medicine is the absolute quintessential tool in which personalization and individualization is critical. So in other words, based upon the individualizing symptoms, every different person with the same quote-unquote diagnosis could get a different remedy. So let me give an example. If 100 people come into my office with bronchitis, and then 100 people, the same people, go to the medical doctor, the MD, with bronchitis, all 100 of them are going to get the same antibiotic and maybe a steroid, same exact treatment, right? Whereas if that 100 patients comes to my office, I could give them as much as 50 different homeopathic remedies to treat the disease. So why are they getting different treatments and the other patients aren't? Because I am individualizing the treatment to the patient, not to the disease process. The double-blind placebo-controlled trial is, by design, antithetical to individualized, personalized medicine, because the whole premise of double-blind is that there are no differences between the people either receiving the intervention or not receiving the intervention. And so this is a very big challenge of doing large-scale double-blind placebo-controlled trials, because homeopathy is very much a high-skill endeavor and practice and tool. You have to understand a lot about how to individualize the picture in order to prescribe the remedy correctly. And so that's a challenge, is matching a modality that doesn't really fit into the double-blind model into a system that validates something's efficacy based on a double-blind trial. So it's challenging. But what you can do are systems-based science in which you have conventional treatment of bronchitis versus homeopathic treatment and measure outcomes. And those trials are pretty remarkable, how positive the outcomes of standard care versus homeopathic care are for both acute and chronic illnesses. Good question, though. It's a good one. Does that make some sense? I'm describing it? Okay. Yes, in the back.
Well, water is like a tape recorder, and it receives information.
Yes.
You can record stuff into it. In fact, there are some computers that are actually doing that with.
Right.
Beyond that as well.
Yep.
But everything is in vibrations and frequencies.
That's
So
correct.
He counted that like that. He was disturbing that. And you put the information into the liquid.
That's exactly, that was very eloquently put. Yes, that's exactly what now in quantum physics we understand to be true.
If you take a scalar energy disk, have you heard of those?
Uh-huh.
Okay. Well, I have one, and my neighbor's a dealer for them. But you can take that and put it in the refrigerator next to water and freeze it, and it will freeze completely different
Yeah,
as opposed to not.
that's right.
And I couldn't sleep for a long time. I was getting so I couldn't sleep. And I used one of those the first night. I just simply put it under my pillow and kind of sleep so hard, and it felt like I hadn't slept
Awesome.
so hard in years.
Yeah.
You know.
Yeah, I mean,
It's made my skin smoother. I had age spots, they're gone.
yeah. Another thing that many people have probably heard of that's quite Up and coming in the scientific literature is earthing, which is another concept where we can transmit electronic resonant frequencies from the earth. And it's one of the speculations of why modern society has so many problems with things like anxiety and stress, is that we're not connected to the earth anymore. There's a lot of frequency transmission that's missed out on that's very important to our physiology.
Another thing, I spoke to Willow when I saw your advertisement here, and I thought I'd come in. And she had said that you had taken Todd Slatford's place. Is that true?
Yeah, I was mentioning my predecessor who founded Coeur d'Alene Healing
I went
Arts.
to him for years.
Yeah, he's my
And that
mentor.
story you told was very
predecessor.
close, only he said Samuel Heinemann instead of Heinemann.
Okay.
And that's the only difference.
Yeah, Dr. Todd and I, this 6-week course, we co-taught it together for the first time. I've taught it twice, and I'll probably be teaching it next winter, but yeah, we taught it together the first time. Yeah. Okay, any other questions before I move forward? Yeah.
So is there a difference between the liquid and the pellets? One is better?
There aren't in terms of functionally. For our practical purposes, both can work well. This class is going to focus on the 30th dilution, so 30C. Someone had a question about which remedies to use over the counter versus from the clinic. You cannot get over the counter anything beyond the 30th potency or 30C, but for acute illnesses, the 30th C potency works beautifully. So I'm a pretty big fan of just using that potency in any acute illness. So versus a liquid or a granular.
You can get to Apis 200 and Arnica 200.
Oh, okay, nice, great, yeah.
This heavy dilution you're talking about, is that similar to when people refer to the essence of something?
Yeah, you could use, I talked about the vibrational frequency, but another term you could use that's less scientific is the essence, or the enlivening, vital force of the substance that we kind of touched on earlier. Yeah, absolutely. Yes?
Complete novice question, but is that the number I'm seeing when I see the Hypericum 30C?
Correct.
Under your tongue?
That's the 30th potency of dilution. That's what that stands for.
I wondered.
Yeah.
On that topic, I've used Arnica, and there is such a thing as an Arnica 200 that you can get in the store, so I'm curious about what you're saying about.
Well, that's what was just
I don't
shared,
know
that
the
there's a couple of remedies you can get a higher potency, but generally speaking, potencies above 30 are prescription only.
Okay.
There's a couple of remedies it sounds like that you can get without that. Yeah, okay. All right, so we talked about the succussion process. Now, I think it's really important to get back to this concept that someone just mentioned about the essence, the vital force. Someone mentioned chi. In India, it's called prana. This concept that there is a vital energy that enlivens every organism. Now, I want to kind of convert that into more scientific, tangible terms. And I think that the terms to use are homeostasis and immunity. Okay? So we can think of homeostasis as the body's capacity to always seek and maintain balance, right? As human beings, our body is constantly striving to be in a state of balance on a physical, on emotional, on a mental level. Some examples physically of that are blood pH, blood volume, O2, CO2 ratios. These are ways in which our body maintains homeostasis. And then next to that, we have this enlivening force that I think is best characterized as our immune system. And our immune system is what activates when a force, when a stressor removes the body from homeostasis. And the immune system comes in, reacts, and makes an intelligent, ordered reactivity to protect the body and move it back towards healing and homeostasis. So, interestingly, we actually see this with drug medications, right? When we give a drug, there are actually two things going on. One is the initial action, the primary action of the drug, and then there's the secondary action, which is also known as a side effect. So the primary action of a drug is the direct action of it on the body. The secondary action is the body's response to that primary action, or to the drug. So it's often known as a side effect. So interestingly, if we translate that into the immune system and homeostasis, essentially what we're saying is the stress to the body is manifested in the symptoms that are produced by the immune system of showing the body getting out of homeostasis. And the secondary response is that immune system directing the body back towards a state of balance. That's the healing effort of the immune system. Okay? So we could say that the vital force, the language of the vital force is in symptoms, right? That the vital force is essentially when there's a bacteria, the immune system creates a reaction, and we present symptoms as an effort of the body trying to move itself back toward homeostasis. So what a homeopathic remedy can do in that context is if it can resonate with that energetic signature of the disturbing force in the organism, right? The unique individualizing symptoms of the acute illness has a very specific resonant frequency. And by mimicking and resonating with that resonant frequency, it can interface by letting the immune system know about what the frequency of the disease process is and aid it in bringing the body back into homeostasis. But because we have done the serial dilutions of the homeopathic and removed the action of the remedy, of the primary action, we don't have that initial aggravation. We have the secondary response being used. Okay? Is someone using a fingernail clipper?
Yeah, I think so.
Yeah, could you stop that? Thank you. It's distracting. Appreciate it. Any questions about that?
So, okay.
Yeah, I know. It's a tough one, isn't it?
Yeah, I just wanted to make sure I understood.
Okay, no, please.
It's presenting the symptoms, and then you give something that, because the body's trying to get back to balance.
The state of homeostasis,
Yeah,
right?
so the symptoms is the body trying to, like, it's already out of whack. So the
Yeah.
symptoms are, is it trying to get it back?
That's correct.
And then you get, you know.
You get a homeopathic that matches the symptoms
Right.
or the resonant frequency of that
So
disturbance.
wouldn't that just put it back into whack but not solve the problem? Wouldn't it just communicate with the body that, hey, let go of the symptoms? When the symptoms aren't the problem, they're the attempt of correcting the problem?
Yeah, well, it's interesting because actually what it will do is help the body more quickly move through that process of resolution and restoration of
So it
homeostasis.
still supports
Yes.
what the symptoms are trying to do. It doesn't just eliminate the symptoms.
Right, because it's that secondary response, right? The primary response of the remedy, right, like cures like, is to produce the exact same set of symptoms, but the secondary response it elicits is supporting the body in moving more swiftly to homeostasis.
Okay.
So that's the action of it.
So is that kind of just like giving your immune system like a little edge by giving you those?
Yeah, it basically, another way to look at it would be, it's allowing the immune system to recognize the disturbing force that's present in the system and know how more efficiently to respond to it.
And then what if someone's immune system is like shocked?
Right, that's a really good question. It is possible in a person who has a really, really, really weak vital force to not respond very well to homeopathics, especially if they're used in higher potencies. The more active, more powerful remedies. So this is why in acute prescribing, we almost always use lower potencies to ensure the organism has enough vitality to respond to it. Okay, good question. Yeah?
So does this mean that when you give a homeopathic remedy, that the symptoms will get worse?
No, because we have potentize the remedy to remove the primary action of the remedy. Remember, the primary action is based upon those provings, which mimic the symptoms of the disease. So that's where the dilution piece, the potentization, is so critical. That second major principle. Yes?
So is that why, like, when you have like twin babies born, and one's not doing good, and one is put them next to each other, and like the good, healthy one shares the vital force with the other one?
Yeah, well, that would really speak to this concept of the quantum mechanics and the resonant frequencies, the energetic, enlivening force that we all possess as human beings that is largely unrecognized in the conventional world, because we can't tangibly prove that that exists. But we know from examples like that that it does, right? And homeopathy works very much on that plane. Yeah, Jackie?
So is this always beneficial and not harmful, or would it be beneficial or nothing would happen?
Yeah, and that's a really great question. So one of the beauties of homeopathic medicine, one of the reasons I want to teach it all to you guys, is because it can treat very powerful, serious acute illnesses, but there is no danger in using it, because if you pick the wrong remedy, it's just not going to do anything. And the disease process will maintain its course. So for a lot of people, and again, this goes into following a case, which we're going to touch on, I'll usually say if we're not seeing within 24 hours improvement in movement towards resolution of symptoms, then we probably used the wrong remedy. It didn't act. It didn't match the individualizing picture of the person's symptom complex. The remedy was not correct in that energetic frequency signature. Yep. Okay. All right, any more questions about the principle piece? Yes, please.
I just like to touch on what you were just saying.
Yeah.
So what about herbs that like are potentially harmful? So if you give them as a remedy and it's the wrong one, wouldn't that have the
Yeah,
potential to, like,
because you have removed through the process of serial dilution the primary action, then it's not going to cause an aggravation because there is no material substance there. And this is what the FDA is getting all twisted up about right now, is they're saying, oh, well, this one case somewhere which probably was an inappropriately made remedy actually had some of a toxic herb in it, and it was given to someone and someone got sick. And so they're blanketly proposing regulating homeopathics and basically banning certain homeopathics based on one or two cases amongst millions and millions of people using homeopathy. But it was probably because of incorrect formulation. But yes, when we properly prepare the remedy, that is not a concern. Yeah. Okay. All right, any other questions about the principle part? I know that was a lot of kind of head thinking to get through.
Todd told a story years ago similar to what you're talking about. It was interesting. He described it as a massive amount of enemy army soldiers coming at you, but they're only cutouts.
Okay.
They're only cutouts. They're not real. And the system recognizes that. And
Yeah.
oh my God, we better get up the bar here and get our soldiers out. That's your immune system.
Yeah. Yeah, that's another
And
analogy.
that's the way he explained it. It was real easy to understand.
Yeah. Yeah, I think that's the same.
But if you don't have your own army, you're still in trouble. But yet those guys are not going to hurt you. There's no toxicity because they're just paper cutouts.
Yeah. Yeah, that's a good analogy. I like that. Yes. Yes. So this concept, the principles are really important, but now let's move into the action, right? Now that you guys get why and how we're using homeopathy, I think that's important to understand if we're going to apply this as a therapeutic. So what we come to then is that we need to be able to know how to take a case, right? So we have access to these remedies. They're out here in Pilgrims. Any remedy you could want. I have them at the clinic. I also have actual homeopathic kits that we personalize for the clinic with all 35 remedies we're going to mention today. So you could have a kit at home. Each one's about 100 doses. So the great thing about homeopathy is it's cheap. These kits are like $150 for 35 remedies, and they will last indefinitely as long as they're stored properly, which is basically keep them out of heat and freezing weather. So they're very accessible, and they work great on kids because the way that you administer them is you take the remedy and you open the cap, and these are the granules, and you tap a few of the granules into the lid. You don't want to put them on your hands because that can disturb the very sensitivity of the energetic nature. And then you drop it under your tongue and let the granules melt under your tongue. Now, how this remedy has been prepared is we've taken those cereal dilutions in 100% alcohol extract, and we've medicated these little granules so that you are giving this exquisitely small amount of medicated granules sublingually, which is a very efficient and fast way for the body to assimilate any sort of medicine. It's probably the quickest beyond injecting the blood. And so we administer them sublingually, and that's how the remedy is used in all practice. Great thing about that too is for those of you who have kids or are thinking about using this with children, infants, toddlers love homeopathic remedies. The inert solution they're made in is lactose, okay? So it is, candy to them. They'll just love it when you give it to them. That's a challenge treating any young child, infant, toddler, is that they can't do pills and liquids. So homeopathy is great for that. Yes?
That's such a small amount does not have the lactose component.
It does not, yeah. And they're prepared in a specific way to make the lactose inert.
And even as young as 4 months?
Yep. As young as a day old, you can use homeopathics. Okay, so any questions about how to actually utilize homeopathic remedies, how they're taken?
I have 2 questions.
Yes.
What would happen in the case of an overdose of that? And then also, when I was taking one of those homeopathic remedies, they were talking about how I had to do it 4 times a day, and that was like really important.
Yeah. Let me mention that in just a sec. So first of all, overdose, impossible to do with homeopathics. I could take this whole vial right now, which has about 150 doses, and nothing would happen. Again, because this isn't the remedy, I don't need this remedy. If I took this remedy over and over and over again, I might start proving the remedy, right? Developing the symptoms that the sick person would have. But it's not going to do anything to me if I just take the whole bottle right now. So again, they're very, very safe to use. Yeah, in the back.
Isn't it true if you take one pellet, it's the same effect as, say, 4 or 5?
Correct.
Okay.
Yeah, very small amount is needed.
And so if it says take 4 or 5, you can just take 1?
Yeah, and the reason that is because the manufacturers, they are businesses trying to make a profit, so they'll tell you to take the whole vial because then you'll spend more money.
And also, isn't it true that if you get a worsening of symptoms, it can actually be a good sign?
Yeah, and I don't want to get too into that because it doesn't happen frequently in acute illnesses. It happens more prominently in chronic illnesses where you get what's called an aggravation. And it has a lot to do with what's called Herring's Law of Cures. It's mentioned in your note, but I didn't spend time on it. Understand that I use homeopathy in my clinical practice all the time for chronic ailments as much as acute ailments. I treat chronic migraines, I treat very powerful episodes of anxiety, depression, bipolar. Any sort of chronic illness is very well handled by homeopathy. However, to be an expert and have good results with that, you need to do a tremendous amount of study because it gets a heck of a lot more complex. And I myself have done over 1,000 hours of study in my education, in my postgraduate education. And I consider myself still a novice, a very passionate novice, but I am not, the foremost homeopath in the region, I would not say. So it's a powerful tool though, and it works incredibly well, which is why I use it all the time. It's very safe as well. So, okay, so Jacqueline had another question about how frequently do you take a remedy? This is a very practitioner by practitioner bias, but my teachers taught me in acute cases to use lower potencies more frequently. So when there is an acute illness, which is what the scope of this class is, I like to use either the 6C potency or the 30C potency 4 times per day. And that's simply another message, as the gentleman put it. It's just flashing out those paper soldiers another time to keep giving the immune system that signal that it needs to respond to the stressor that's putting it out of homeostasis. Okay? So 4 times a day is typically how much I'll recommend. Now, once the illness is moving swiftly in the direction of cure, the nice thing is that the army is already mobilized, right? We don't need to keep prodding it if it's already engaged in its action. So that's very different than, say, botanicals or drugs that you need to keep taking until the symptoms have completely subsided. Once we definitively see that direction of cure happening, we no longer need to use the remedy. So I usually tell people to be safe to keep taking the remedy till it's close to resolution, just in case something stalls it out. And it's not going to harm it to keep taking it, but you do not need to take it till the full conclusion of the illness. Yeah?
That's interesting. I was wondering about, because you gave me one for my 3-year-old to help him just kind of like soothe him or something. And like you said, once a week, and I'm like, whoa,
Right.
magic is this, that once a week.
Yeah, well, and that's again dealing with a more chronic type issue. There's probably a more kind of psycho-emotional plane that we're working on there versus an acute issue. Okay, so it's a little more complex when we get into that.
So what if we did more than once a week? Would it?
Well, you have a chance to create a little aggravation if you do a high potency too frequently. So those lower frequencies, 6 and 30, are very safe to repeat frequently without any aggravation. Okay. So then what's most important here, right? We talked about homeopathy. We have to treat the person with their individualizing symptoms, not the disease. And again, what that translates to is we need to be very good at taking the symptoms, right? Because if we don't understand those individualizing symptoms, how are we going to pick between, say, the 35 remedies I've laid out for you, which one's the right remedy for that person, right? Because we need to know the specifics of the disease presentation. And I have kind of developed, or I shouldn't say I have, there has been developed a really good methodology to do that. And it is called a Benninghausen diagram, which you don't need to write down. That's just the guy from Switzerland who came up with it a few hundred years ago. But what I am going to write, if I can find a page, is the way that we structure this. So when we have a sick child, or we are sick ourselves, that's not working. We want to be able to describe the characterizing symptoms, or what are called the keynotes. Keynote symptoms, there's a good one. All right. So keynote symptoms are the things that characterize the process. And in terms of giving us the most prominent individualizing symptoms. So we start with the descriptors. Okay. So let's use one. We already talked about Belladonna, okay? So descriptors would be things like hot, red, high fever, right-sided. Okay, so these are some of the descriptions of someone who needs Belladonna, the types of presentations they would have. And I should probably start with the first section, which is big, is the condition. Okay, this is, all right, so headache, fever, sore throat, earache. All right, these are some prominent acute conditions that often Belladonna will be successful in treating. Here are some of the descriptors of what that headache is like. It's hot, it's red, it's throbbing. It comes on suddenly. Okay? Ways we can characterize the presentation of the chief complaint. Those are descriptors. So we want to know as much. Tell me what it feels like. Describe what is like for you, this presenting chief complaint. Tell me about the location of where you're feeling it, right? Get very, very specific about the unique characteristics of how that individual is having a sore throat, for example. Then we have what's called causation or modality. So this is what causes it, what makes it better, what makes it worse. So example with Belladonna, this is Belladonna, which is the deadly nightshade. It is worse motion. It is worse light or noise. So if we're talking about the headache, right, those could be aggravating factors. It is worse from lying and better standing. Okay? And by the way, what I'm saying worse, we see the little Pac-Man sign. If it's facing the word, it means it's worse. If it's facing away from the word, it means it's better. Okay? So you'll see in your little cheat sheet that I gave you, you'll see those little Pac-Man symbols for better, worse, right? So this piece about causation, what makes the symptom, the chief complaint, better or worse, is a very important characterizing symptom often. Okay? And then lastly, concomitants. All right? Concomitants are other accompanying symptoms not related to the direct chief complaint. So, say someone with a Belladonna headache, they're also very restless. That's a characterizing feature of Belladonna. Their pupils may be dilated. Very common. Again, when you take the deadly nightshade, it dilates your pupils. Oftentimes, there is spasm. Okay, to name a few. Now, there are many more. But you see, we've essentially created in each section of this Benninghausen diagram a set of keynote symptoms characteristic of Belladonna. So if we have someone come in that has a headache, and it's hot, it's throbbing, there's a high fever, it's worse light, it's worse motion, they're restless, their pupils are dilated, what remedy are we going to think of? Belladonna, right? Okay. So you see, the more characterizing symptoms you have, the more certain you can be about your prescription. So say all we know is that it's a headache. Okay. So on your breakdown on the chart that I gave you, I listed at least 6 remedies that are good for headache. So I listed Belladonna, Bryonia, Sepia, Natrium muriaticum, Arnica, Gelsemium, and Ignatia. Okay? So if all you had to go on was headache, then the only thing, then you would be taking a shot in the dark between those remedies of which remedy would be correct. Right? So that's what we call a one-legged stool. We don't really want a one-legged stool. It's pretty wobbly, pretty easy to fall off about it, right? It's pretty easy to be inaccurate in prescribing. So we want to get, ideally, what's called a 3-legged stool. All right, so we have the headache, but we also know that it's a throbbing headache. And we also know that it seems to be a lot worse motion and that the patient is very restless. Okay, well now we have a little bit more to go on, right? We can really take these symptoms and say, yeah, that doesn't really fit this other remedy, or that doesn't fit these other remedies, but it sounds like it could fit Belladonna. Now, let me say something else. Let's say it has all those modalities. It has headache, it's throbbing, it's restless, it's worse motion. But let's say it's left-sided and not right-sided. Right? Let's say that's the symptom that shows up for that patient. Does that mean we chuck out Belladonna and say that, oh, that can't be it because it doesn't perfectly match? No, it doesn't. We're never ever going to see, or very rarely, I sometimes see it, we're very rarely going to see a set of symptom complex that perfectly matches the remedy proving, right? The characterizing symptoms of the remedy. We're always going to try to get as close as possible to that remedy and pick amongst our best choices. Yeah.
That being said, are there anything in the homeopathic remedy families that can't be given together, that they're contraindicated to give them together?
Well, so that's another part of the, I didn't mention the last principle, which is the single dose, right? Let's say that you said, oh, well, these 7 remedies are good for headaches, I'm just going to give the person all of them, and one of them's going to work. Unfortunately, it doesn't work that way. Yeah, we don't see very much success with that. You'll see out in health food stores combination remedies that are attempting to do that. And my experience is with those, they're not very effective. I've occasionally seen them to be a little bit helpful, but truly the classical homeopathy uses the single remedy rather than multiple. Yeah. That's a great question. Yeah, Jamie.
Sorry, what does that say? Concomitant?
Concomitant. It means that symptoms, characteristic symptoms the patient is presenting that are not associated with the chief complaint. Okay. Yeah, so, you know, with Belladonna, we talked about a few. Let me give another example of another, you know, set of concomitant symptoms. I guess a good one would be Nature muriaticum. Let me just read a few from that remedy. Or arsenicum. So arsenicum is very anxious, insecure, fearful, very chilly, thirsty, orderly, fastidious, despair of recovery. Those are some concomitants. Whereas Belladonna is restless, flush-faced, hot head, oversensitive to pain, glassy eyes, violent inflammatory conditions. So it's just basically characterizing some of the other information about what the person could be like, right? What's that?
Almost like behavioral characteristics?
Yeah, behavioral characteristics would be good, but interestingly with the acute, oftentimes behavioral characteristics will develop that are not typical to the person, right? They're the acute characteristics that accompany the illness, right? That are characterizing. Yes?
How would you deal with the dilemma that if you had 2 separate acute things going on that you really needed to treat?
Yeah. Well, interestingly, that's a great question because it illustrates a key point about homeopathy, which is that these remedies are not single uses, right? In fact, when you read the Materia Medica, the proving of the remedies, it will go through every single organ system in the body and describe the symptoms that are associated with someone needing that remedy. So oftentimes homeopathy is the perfect tool when there are multiple complaints showing up because you need to take those individualizing symptoms and match them to the remedy that resonates with both of those symptoms, which can be done.
But keeping a single remedy then, you wouldn't take 2?
No, yeah, you'd use one remedy. You'd use one remedy, again, because you're not treating the condition, you're treating the person with the conditions. And so when you take the totality of their symptoms, when you get their 3- or 4-legged stool, then you seek the remedy to which that matches most closely. It's a great question, and one of the beauties of homeopathy is that these remedies that we're talking about that are in your list are remedies of many uses. So they can be used, like for example, I'm saying some of the most prominent uses of Belladonna, but Belladonna could theoretically be used for almost any chronic or acute condition if the characterizing symptoms of the patient match Belladonna. Right, that's the key. Yes?
Should have it, like, say you said you had 7, you use 1, and then wait, like, how long before you try?
Well, again, I usually say that if we're not seeing movement towards resolution within 24 hours,
Then you try.
we probably would consider a different remedy. Yes. So, in practice, how do you guys take this concept? All right, so now you know how to take the case, right? You know the main categories when you're asking your loved one or thinking yourself, the types of things to ask them about to gather as much information as you can. Well, what do you do next? Well, again, if you were taking my 6-week course, we would go through the 35 most commonly used remedies, the ones I showed you in here, for acute illnesses. And we would talk about each remedy at length, and we would talk about each condition associated with each remedy, and more importantly, the characterizing features of each of those remedies, so that you could begin to develop a working knowledge of the remedies and their main indications, the main things you can start to look for that can make you suspect, oh, this case might be appropriate for Nature Muriaticum, or this case might be appropriate for Mercurius, based upon your knowledge of those individualizing symptoms. But of course, to get expert at memorizing that takes years of study. Even I consult my references all the time because I need some help with that. I don't remember 35 remedies, let alone 300 remedies, what the characterizing symptoms are. So often what I will do is use some of my resources. And so what I have given each of you in your packet is I have given you a really fundamental kind of basic cheat sheet. So it says Homeopathic Kit. It lists all of the remedies, 1 through 35, and it describes a lot of the characterizing symptoms of each remedy. So that in addition to that, what I have given you is an overview of the 6-week course of the sections that we go through, which remedies are the most commonly found remedies for acute conditions. So sinusitis, I list Calibichromicum, pulsatilla, Nature Muriaticum, Hepar sul. Okay, so an example of how you could use this in practice is, say your spouse has really bad sinusitis, and you start to ask them about the characterizing symptoms. Is it thick? Is it thin? Is it colored? Do you have a headache? Is it better in open air? Is it better in a warm room? Do you also have accompanying, I guess, droopy eyes or weakness or fatigue? Are you really chilly? Are you really hot? Right? So you're gathering the characteristic symptoms, the keynotes, through your diagram. And once you have that information, you can go in and say, okay, what are the main remedies for sinusitis that Dr. Hunter has listed as probably going to show up most frequently? Doesn't mean the right remedy is going to be on this list, unfortunately, because it could be many remedies, but there's a really good chance it'll be on this list, because I've been pretty comprehensive in identifying these common remedies that show up. So, not 100% of the time, but many of the time, that remedy will be on this list. And so then you go read about Calibichromicum, pulsatilla, Nature Muriaticum, Hepar sul on your little cheat sheet, and you say, oh, okay, some of these symptoms really match well. I have the 3-legged stool to go off of that makes me think this is a Calibichromicum case. And so then, based upon that process, you would then prescribe the remedy 4 times a day at the 30C dose and observe the change of the symptom complex. Okay. Does that make some basic sense to you guys about how you can take away a tool from this class and actually kind of start to apply it? Okay. Any questions about, I just went over a really big process really quickly, so I understand if you don't get it completely. Are there any questions I can answer about it? Yes?
You know how they've got these arrows here? You said that the arrow when it goes to the left is worse with, and then so what is the
Yeah,
arrow
so,
when it goes to
so
the right?
if the open part of the arrow goes toward the word, it means it's worse, right? Versus if the open part, the closed part of the arrow goes towards the word, it means it's better. So if you look at number 7, bryonia, it's worse with motion, better with rest. Okay, so the Pac-Man facing the word, worse. Yeah. Yeah, Jackie?
So, I thought we were gonna be making like our own witch's brew. They're already pre-made.
Oh, yeah.
And they last for how long?
They last basically forever as long as you don't expose them to too much heat or too much cold.
That makes me feel way better.
Yeah, so any remedy you ever get, yeah, I mean, as long as you keep it in the cupboard and just store it, it's never going to go bad. It will never lose its potency. Yeah, it's pretty cool. Again, another reason why homeopathic medicine is not very kind of smiled upon in our consumer profit-driven society, because it's not very profitable, right? It just gets people healthy, but it doesn't really go bad, it doesn't cost very much. And it's really easy to make. So that all being said, I want to make one disclaimer, right? By no means am I telling you guys that you should forego medical treatment to using homeopathic remedies. But again, as many of us can appreciate, many of the illnesses we get are viral, which conventional medicine can't do much about. And many times we can successfully employ homeopathic medicines to swiftly help the body's vital force move back to a state of homeostasis more quickly than it would have otherwise without that medicine assisting the process. So there are circumstances where the symptoms can become very serious. For example, when a kidney infection or when a urinary tract infection moves up into the kidneys, that's a serious thing. If that isn't treated aggressively, it can lead to damage to the kidneys. And so there are cases where if things, again, are not improving relatively quickly, within 24 hours, it may be necessary to seek a higher level of care. And in that case, I treat acute visits all the time, especially this time of year. I would say probably a quarter of my consultations are acute visits, because sometimes either people don't have the tool of homeopathy or they're very stuck in their healing process and the acute condition is becoming subacute or more chronic and the patient is not getting better. So if you tried a couple of remedies and you're not making any progress and things are either staying the same or getting worse, it's time to seek more care, to call the office and say, I need to talk to Dr. Hunter for 10 minutes and figure out what remedy and treatments to use. Or because we don't want an acute, another example is a sore throat that turns into a mild bronchitis that turns into pneumonia, right? If it's not treated and it's not reversed efficiently, then that pneumonia can become a very serious thing with pretty long-term and even life-threatening consequences. So I just want to put that out there that, we don't just sit here and use homeopathy until, we can't do anything. We need to look to other supportive care if we're not making progress. And by the same token, let's say I get a slightly sore throat. Does that mean I need to start using a bunch of homeopathic remedies and start going through my list when all I really have to go on is a slightly sore throat? No, because very likely if I start fasting and doing hydrotherapy, my body's going to take care of it quickly, right? So homeopathy really comes into play when the characteristic symptoms have developed, meaning the disease process has progressed enough to where we can actually characterize the illness more substantially. So oftentimes, if it's just, a little minor setback, a little quick fever, a little runny nose, and we employ basic naturopathic therapies, we don't even need to use homeopathy, right? We just need to assist the body, the vital force in its healing process and get out of its way, right? But sometimes when that disease process, when that disturbance of homeostasis gets into a place of being stuck, and the body is, the immune system is not moving it back into homeostasis, is not responding, then being able to treat the person and the individualizing symptoms with a homeopathic remedy is invaluable. And I have found that to be in my practice. So I can say almost without hesitation that almost every person who comes to me with an acute illness gets a homeopathic remedy. Because, and I'm not 100% accurate a prescriber, but I do know that it is an invaluable tool in more quickly relieving and alleviating acute illnesses. And it certainly doesn't do any harm. In contrast, someone who comes in with a sore throat or an earache and is given an antibiotic, that can create significant side effects that are long enduring and even can lead to chronic diseases. It actually weaken the individual's immune system. So I find it to be a much better tool, a much safer tool, and just as effective, if not more so, than conventional alternatives like antibiotics and steroids. So that's another reason why I'm such a fan of homeopathy, is it adheres to one of the main naturopathic principles, which is first, do no harm. And the second, probably most important principle of naturopathic medicine is recognizing and stimulating the vital force of the organism, which I think on a paradigm level is the central thesis of homeopathy, is keying into that vital force through that energetic frequency or resonance and stimulating it to act. Okay. Yeah, questions? Okay. Yes, Jane.
So you can use wet socks on a baby?
Sure.
That just seems mean, okay?
Yeah, of course you can. Yeah.
And also, if you had like an individual site, like, I don't know, say you hurt something on your arm, you were to do the hydrotherapy, like, how long would you do, like, hot, cold?
It's usually about two parts hot to 1 part cold. 2 to 1. So it's not equal. It's twice as much hot to 1 to cold.
The end on cold.
Yeah. And by the way, when I talk about acute ailments, as you'll see in your outline, yeah, and non-cold, there are a lot of traumatic acute illnesses that respond beautifully. The most famous remedy there is, of course, arnica, which is what kind of made homeopathy famous in more mainstream conversations. But there are a lot of other great remedies for sprains, strains, blunt trauma, wounds, surgical incisions, stings, bites. And again, I've listed those on your outline. And I would love to spend, 12 hours with you guys going through the remedies, talking about the individualizing symptoms. But you can see that that would be a very overwhelming mental process.
When are you going to do the 6 classes?
It's a really good question. My feeling is that I feel like I'm going to be ready to do it next year. It's been a year or 2 since I've done the last one, and so yeah, I think I'm ready to come back and do it. I need a little break there, but
Next year?
yeah, next winter. Yeah, wintertime is just a good time because it's dark out and we can hang out in the evening, and we usually do it here. So, and what comes with that is I have a binder with these diagrams I showed you for every remedy. So we go through all the remedies, and we also go through all of the conditions and talk about how to treat them naturopathically first, and what signs know what to tell us. It's a red flag, we need to go to a doctor, and kind of all that good stuff. So it's a fun class, and I've recorded most of them that I think at one point I'll make available, but I want to re-record it next time I teach it. So this was more of a little introductory to homeopathy. If you want to learn more, I have a couple of videos up from some of those classes on our website. And again, I brought a couple of really good books that I want to mention to you guys. So one of them is called Everyone's Guide to Homeopathic Medicine. And this is a really old version. The new version looks different. It's Stephen Cummings and Dana Ullman, D-A-N-A-U-L-L-M-A-N, and Stephen Cummings, C-U-M-M-I-N-G-S. So this goes through principle theory, kind of naturopathic treatment, kind of like the class we taught today, and then it talks about the specific remedies. So this is a good, introductory one, as along with the notes that I gave you guys. The one that I use more frequently in my clinical practice, this one's a little pricier. I get like 70, 80 bucks, but it's really good. This is a really renowned homeopath, Roger Morrison. It's called Desktop Companion to Physical Pathology, but this one's incredible. It's more diverse. It goes through a lot more remedies. It's kind of more for a higher level practitioner, but nevertheless, it's, if it's a one-time investment, it's a wonderful resource. I use this in clinical practice almost daily, so really good one. Yeah, Linda.
I was just saying that I've had the yellow book and the kit for 20 years. And
Yeah.
it's just invaluable.
Yeah.
I love my copy.
What was the name of the yellow book? What was the?
Yeah, it's called Everybody's Guide to Homeopathic Medicines. And we try to carry a couple at the clinic too, to just for those people who are really wanting to get into it. But yeah, good book. And there's a newer version, like I said. Yes?
I have kind of a stupid question. But
No
when you said
such thing.
the hydrotherapy,
Yeah.
I get the shower thing where you do the cold and the hot.
Yeah.
Is when you do the wet socks, the hot is just when it evaporates? Is that where it gets hot, or where's the hot?
Well, there's no, so when you do the insulating therapies,
Yeah.
you're actually, it's not quite the exact same thing. It's not the contrast, but
Okay.
the action of stimulating circulation.
Oh,
So the body's bringing circulation to the socks and it's drying them out.
oh,
Yeah.
It does get warm.
Except
I
for,
mean,
You think of it,
except for that, you just say that you have to get warm first, right?
Yeah, you don't want the feet to be really cold before you put the cold wet socks on. You want to make sure that they're, at least
I guess the
somewhat warm.
circulation.
Yeah, yeah,
Okay, thanks.
exactly. Any other questions about our topic or class? All right. Well, thank you guys all for hanging in there. I know we're slightly over time, so those of you who need to scoot, great. Thank you for coming. I will stick around after these topics to answer questions. If you want to learn a little more about our clinic, check out our website. We got some information about us in the back. And again, thanks for coming, and see you at a future open forum.
Thank you.
All right, so question about homeopathic detox. Who's that? Okay, all right. So my feeling there, Tanya, is that I don't prescribe detox protocols. The closest thing you may find to it is kind of like a hybridization of homeopathy, and it's called drainage. So biotherapeutic drainage is a combination of homeopathy with metals and herbs. And specifically, they're called UNDA numbers, U-N-D-A. And it's a whole kind of associated science. Yeah, and they're all about detoxing, draining the congested organs. So if you were interested in learning more about detox with homeopathy, that might be something really cool to look at.